I really hope that your practitioners that you've used antibiotics with you use them as a last resort, because I can't tell you how many times clinically I've seen patients develop heart palpitations, arrhythmias, a dysregulated heart pattern after the use of antibiotics, especially because their practitioners may have just not supported them accordingly during and especially after. A majority of immune compromised patients are already extremely deficient in potassium and magnesium, and especially when you take something to kill off certain bacterias, this will further put a huge burden on the vagus nerve and a further loss of potassium and magnesium, which are critical for optimal heart rhythm and function. And the second somebody takes something as simple as a Z-Pak for an infection, this can be enough to send that cardiac rhythm spiraling. And this information has been out there in literature. I just needed to share with you guys, especially if you have a history of strep, UTIs, you're taking that antibiotic one time a year before your doctor discussing, well, hey, maybe that gluten and dairy you're eating is disrupting your immune system, your mucous membranes, and feeding strep in the first place. You'd be surprised at how many patients that sit in front of me have actually healed their gut as we discussed their triggers, worked on their barrier function, worked on the environment of their microbiome to strengthen it, and their heart palpitations actually go away. And it's a huge red flag when you've been given antibiotics for a viral infection in the first place. And this is very common. So make sure you know exactly what your microbiome health looks like. Get a 3-day stool analysis to discuss the triggers, sources of inflammation, and how to strengthen your environment in the first place. Send us a message if you need some more information about this.